Hello friends, today we are diving into the complex world of facial pain. Our guest, Dr. Spierings, is a top headache and facial pain specialist. We will explore what facial pain is, its causes, how it differs from regular headaches, and how you can get the right diagnosis and the treatments. Before we get started, please subscribe to my channel as it helps us to get the good guest and the right information for you. Let's get started. Hello, Dr. Spierings. Welcome to my show podcast with Shilpa.
Hi, Shilpa. Glad to be here. Thank you for inviting me again.
And so today we are going to start with the basics, like what is the face pain and how it is different from the regular headaches.
Yeah, first of all, thank you for wanting to tackle this topic, the topic of face pain, because it doesn't really get an awful lot of attention, not just in the media, but also, sadly enough, in medical education. Um, Face pain is different from headache in terms of both the diagnosis and treatment. How do we distinguish between the two is not always easy. It tends to be rather arbitrary. For example, what we generally say is that we take the line of the eyebrows, and when the pain is below that level, we talk about face pain. If it is above that level, we talk about headache. But that's, of course, an arbitrary thing, and arbitrary things do not tend to work in medicine. In this regard as well. For example, we have cluster headache, which is a migraine related condition. The pain is generally most intense in or behind the eye, so that's below the level of the eyebrows. And then not an uncommon face pain condition is what we call ophthalmic zoster or shingles of the forehead, which, as the name implies, is on one side of the forehead, so above the level of the eyebrows, but we consider that face pain. So you can see the distinction is not really clear, even looking at it from a strictly medical perspective, and hopefully we'll be able to shed some light on it during this discussion.
Mhm. And if we dive deeper into it, then what is the main cause of face pain?
Yes, that is a very good question, if only because of the fact that when you, for example, ask a physician, give me a cause of face pain, generally only one comes up, and that is trigeminal neuralgia. That is in and by itself a horrible type of face pain. You get these sharp, lightening jabs in your face. But it is a very rare condition, and it's certainly not the most common cause of face pain by far. It's a rare condition. It's a disabling condition, though, if you have it, but it's rare, and it mostly affects, older individuals like myself, or even older, people in their 70s, 80s, or even older. That is the face pain that people tend to be most familiar with, certainly physicians. It's very often the only type of face pain they know. And because of that, it tends to be grossly overdiagnosed and treated. And especially the treatment can be a problem because sometimes that involves brain surgery. And so under those circumstances, you really want to make sure that that's the correct diagnosis. The most common cause of face pain, however, is what we refer to as temporomandibular disorder, or TMD, which gives you pain in the jaw area, often on both sides, but it can certainly also be on one side only. And if it's on one side, it tends also to be more intense, or if it's predominantly on one side, it tends to be more intense. And then you have also pain that is located more centrally in the face, mid-face. Pain around the nose and the cheeks, and that tends to relate to nose and sinus conditions. So we have really three types of face pain. Trigeminal neuralgia, which is a neuropathic or nerve pain condition. So we have nerve pain conditions in general, but these are the least common. Most common, I would say, is a temporomandibular disorder, or TMD, and I think second, nose and sinus issues that cause face pain.
And like a lot of people, they confuse face pain with the migraines or the tension headaches. So how it is different from those in terms of symptoms?
Yes, migraine is a certain presentation. tension headache and migraine are your most common headaches.
Mm-hmm.
Um, they tend to have a different location in the head, although that's not really the distinguishing feature. Tension headaches tend to be more across the forehead or around the head, feels like a tight band. Migraine headaches tend to be much more localized, often on one side, maybe in the temple area, but certainly can also be across the forehead, behind the eyes, or behind one eye or the other. Location is not really what necessarily distinguishes these two types of headaches, but it's really the intensity that those kind of pains generate. For example, a tension headache would be a regular headache, like all of us have every so often, a tiring day or a lot of stress at work or something like this. It's a low intensity headache. Some rest, relaxation, some over-the-counter medications will take care of that. Migraine headaches are much more intense. Over-the-counter medications do not really tackle those kind of headaches. And also, these are the kind of headaches that are so intense that not only do they make it difficult, if not impossible, for you to function, but they also derange the function of the body as a whole. So people tend to be sick with them, nauseated, sometimes vomiting. They tend to get light and noise sensitivity. So these are the kind of things that you really don't see with face pain. So they're different presentations and have different underlying causes. Migraine is a strongly genetically determined and inherited condition. Tension headaches are really part of life that all of us experience every so often. And especially for migraine, as we talked about in the last session, we have very good medications available to treat these horrifying and disabling headaches. But that's a different story from face pain.
So is this usually related to like nerves or some issues? Face pain is related to all these things too.
Yes, so tension headaches are caused by, muscles becoming tight, not so much from stress, but I think generally from fatigue. Migraine headaches are more related to widening and inflammation, widening of blood vessels that subsequently become inflamed. While face pain, on the one hand, can be due to nerve damage, but that's really the least common scenario. But most commonly, they're due to temporomandibular disorder from muscle tightness in the jaw muscles, and they can also be related to the nose and sinuses, and then the problem tends to be in the nose, not so much in the sinuses. The pain may come from the sinuses, but the problem resides in the nose. And unfortunately, under those circumstances, when people even look at the nose sinus system, they tend to look at the sinuses, not in the nose, and very often fail to diagnose what is in actual
Yes.
fact wrong with the patient.
Yes, you are right. It's really difficult to differentiate between, for a patient to differentiate between a sinus and the facial pains. They,
Yes, it is. So if you have pain from sinuses, that pain is in the center of the face, in the nose cheek area. If it's on both sides, which is most common, it tends to be low-grade pain, more like a pressure. Patients have described it to me, saying it feels as if I have a plunger stuck on my face or a mask that is very tightly pulled to the back. Again, that is a low-grade pain, and that pain comes from the sinuses. What happens is that the sinuses communicate with the outside world through very small passages, and when these passages get closed, when they get blocked off, the air gets absorbed out of the sinuses, and that gives that drawing sensation centrally in the face that a lot of people know from experience, and it's called sinus headache, although it's really more a face pain than it is headache. It's kind of located centrally in the face, and although the pain in that sense comes from the sinuses, the cause really resides in the nose. It's a combination of narrow passages, which is congenital, you're born with that, and on top of that, chronic inflammation in the nose and sinuses, generally from non-seasonal allergies, and that is something then that should be treated. If that central face pain is on one side only, so that can be on the left or the right, it tends to be very intense, and it can be life-changing, so intense, as I've also seen it in practice. And that is a totally different problem that also lies in the nose, and that has to do with bony contact, a deviated septum that develops a spur, an extra piece of bone that at one point in time contacts a swelled body on the side of the nose. Usually that's during a flare-up of allergies or a head cold or a flu. And this is a kind of a headache that comes on from one day to the next and then is persistent. And as I said, can be very, very intense. And because it is bony contact, it generally needs a minimally invasive surgical procedure to get that eliminated. But it's very often not diagnosed because these people tend to end up with neurologists, and neurologists really do not know anything about face pain other than trigeminal neuralgia, and certainly not face pain that comes either from the nose and sinuses or comes from the jaw muscles in the sense of temporomandibular disorder or TMD. So it is a big challenge for patients in that sense.
Right. So, like you said, fatigue is related to face pain, like certain lifestyle factors also, they are related to the face pain.
Yeah, not so much, I think, as with headache. But if you,
Mhm.
for example, have face pain related to temporary disorder, so you have pain in the jaws, both sides, maybe one
Mhm.
side only,
Mhm.
that very often comes associated with clenching and grinding.
Mhm.
And that's not really something that people do consciously. That happens unconsciously as a result of the tight jaw muscles. It very often happens at night, so people are not aware of that. But the clenching and grinding is important in two ways. One, of course, especially the grinding, it wears down your teeth, the structure of your teeth. You see that especially with the teeth that are called eye teeth in the corners there that tend to be relatively big, and you can sometimes see that in people who have TMD. They're worn down.
Mhm.
So that is one issue, and the other issue is that the clenching and grinding causes a vicious cycle. So it's caused by these muscles, jaw muscles, being tight, but the clenching and grinding in it by itself makes these muscles even tighter. So it's a bad
Mhm.
vicious cycle that needs to be interrupted. And for example, it's important when you, for example, clench during the day. For example, you're
Mhm.
driving your car, it's a busy road, and you sit like that. To be aware of that, and then maybe one way to solve that is by pushing your tongue up to your against your the roof of your mouth. When you do
Mhm.
that, that automatically will relax your jaw muscles and open your mouth so that you're not sitting like that and further aggravating that tightness that already exists in the jaw muscles.
Yeah, that's a good, I think, good thing you told that can help viewers.
Yeah,
And
because I think it's very common, for
mhm.
people to sit like that behind the
Then,
wheel or under other circumstances that are stressful. You can be
mhm.
at a stressful meeting or whatever and find yourself,
Yeah, if you are
clenching
getting
your jaws.
you are getting late to a meeting or you have to reach some place on time and you are getting late, so you sit behind the wheel like this only. So I think
Yeah, so I think
definitely.
it's something to become aware of. And then
Mhm.
again, when you push your tongue against the roof of your mouth, that will then automatically relax it. But it's more of a matter of, paying attention to it and becoming aware of it.
Right. And like so many people, they mistaken face pain with a headache, like we talked about now. Why it is sometimes so tricky to diagnose it.
If you if you're familiar with the problem, it's not that difficult to
Mhm.
diagnose.
Mhm.
Again, the problem I think is this that um, physicians tend to know only one type of face pain, that's trigeminal neuralgia.
Mhm.
The most common type of face pain is temporomandibular disorder, typically taught in dental schools, not in medical schools, so physicians do not tend to know anything about it. Dentists do, it's part of their education, but when you go to a dentist, what does the dentist do 95% of the time? Looking
Mhm.
inside your mouth.
Yes,
not
right.
looking at your face, right? The moment you sit in that chair, he asks you to open your mouth
Mouth.
and doesn't really concern himself with what is outside of the mouth, such as the jaw muscles that are the source of the pain in temporomandibular disorder or TMD. Um, as I said earlier, you have really three categories of face pain. You have nerve-related face pain. Face pain that's due to nerve damage. Trigeminal neuralgia is an example of that, but it's certainly not the only nerve pain that occurs in the face, but that's the best known example. Then you have sinus-related, nose and sinus-related pain, and temporomandibular disorder related pain. And you can certainly look at that yourself also to a certain extent. First of all, when you have face pain, you want to make sure it's not nerve related, that there is no nerve damage causing that pain. And you can even simply test that yourself. We're dealing with the face, and the nerve that supplies the face, the sensory information, comes from what we call the trigeminal nerve, like in trigeminal neuralgia. Trigeminal nerve. That nerve has three branches. One of them goes to the forehead, one of them goes to the cheek, one of them goes to the jaw. So these are the three parts of the face that have different, are supplied by different branches of the trigeminal nerve. The first thing you want to make sure of is that these three branches function normally. And you can simply do that by gently touching the face in those three areas: the forehead, the cheek, and the jaw. Now, nerve pain in the face is always limited to one of these three areas and always limited to one side of the face only. Okay? Because it's only one of those branches that is in fact affected in those cases. And what you do is you touch very gently, and you ask yourself the question, do I feel this the same on both sides? And is that sensation normal? When you have nerve damage, when you touch it gently, it may feel as tingling. We call that paresthesias in medicine. That means the nerve is not functioning properly. Or worse, you may feel that as if it's touched by a, let's say, cold metal rod. It's unpleasant, that sensation. That's called dysesthesia. And the worst scenario is when, in fact, you touch the face very gently and it provokes pain. We call that allodynia. Patients with nerve pain, face pain due to nerve damage, they very often don't even want you to touch their face. They kind of shield their face because they know that when you touch it, it will hurt. So it's generally very obvious whether you have nerve damage to the face or not as the cause of your headache. If you do not have nerve damage to the face, and that test that you can do yourself is normal, you feel things well, touching those three areas of the face on both sides, it means you do not have nerve pain, and you either have a temporomandibular disorder, which pain on both or one side of the jaws. I call that the periphery of the face. You have peripheral face pain on one side or the other, or you have a problem with the nose and sinuses, which would be centrally in the face on both sides or on one side or the other. So it's relatively simple and straightforward, and an approach that you can certainly apply yourself as a patient so that you have some sense which direction you have to seek medical advice. The problem is, who do you go to? For example, if you think it's a nose sinus problem, you may want to go to an ENT surgeon, but most ENT surgeons have very little, if any, knowledge about face pain. If you're lucky, the ENT surgeon may do a sinus CT scan, because that's really what should be done. But then he or she will look at the sinuses. It's called a sinus CT scan after all. They will look at the sinuses. That's not where the problem is. Even though the pain may come out of the sinuses, as I've explained, the problem resides in the nose. And generally, that's not an area where people look at. So there are issues with that. And when you have pain that you think might be from a temporomandibular disorder, you can go to a dentist. But, the dentist may have limited, although it's really part of his specialty may have only limited knowledge there and may not really know what to do with you.
Mhm.
And if you go to your GP with that kind of pain, he or she may not even know that there is something like TMD or temporomandibular disorder and pain related to that,
Mhm.
face pain related to that. So it is a problem, even if you kind of get a direction yourself based on what I said to find the right medical or dental care for that problem.
Mhm. And like, can you share some common patient case where the face pain was mistakenly taken as something else?
Oh, sure. Yeah. An example of a young lady, I
Mm-hmm.
think she was late 20s, and
Mm-hmm.
she worked in a store, and
Mm-hmm.
that store was robbed while she was there. So it was a
Oh
very
my God.
traumatic experience.
Mm.
She basically was the victim of a robbery.
Oh.
Um, and as a result of which, of course, she was very upset
Mm.
and cried a lot and developed face pain, one-sided face pain in the nose cheek area
Mm-hmm.
subsequent to that robbery, persistent face pain. The face pain started, during that whole episode um, when she was very emotionally upset, and it didn't go away.
Mm-hmm.
And of course, because of the nature that the pain had developed, the primary care physician who she consulted thought it was a psychological trauma that
Mm-hmm.
caused that particular pain. And so she was sent to a psychologist who treated her for some length of time, but without any resolution of the pain. And it was very, very intense pain that she was suffering from on a daily basis. And with that psychological treatment ineffective, the primary care physician subsequently sent her, not knowing really what to do, to a neurologist who diagnosed the patient as having cluster headache. And
Mm-hmm.
now, cluster headache is a condition that mostly affects men, and it comes in short attacks that last maybe 1 to 2 hours. It's one-sided face pain as well, generally located in and behind the eye. But cluster headache attacks tend to come with other symptoms like tearing of the eye, reddening, congestion of the nose, and running of the nose. And she had those kind of symptoms as well. So in
Mm-hmm.
addition to the face pain, she had tearing of the eye and running of the nose. Nobody had really paid attention to that, and the neurologist, the consultant neurologist, thought on the basis of those kind of symptoms that she had cluster headache, was a wrong diagnosis,
Mm-hmm.
and tried to treat her, but also unsuccessfully. And ultimately, after a couple of years, and the patient was really desperate. She wanted to get a family. She didn't even want to do that because she didn't think she could take care of a child. So it really was very consequential to this particular person. So ultimately, I saw her, and then based on the history and the presentation of the pain, I knew right away
Mm-hmm.
that she had a face pain due to bony intranasal contact.
Mm-hmm.
So what I did for her is I gave her a lidocaine a nose spray, which is a local anesthetic,
Mm-hmm.
to get her some relief, which she could squirt up the nostril on the side of the pain. I did a sinus CT scan and diagnosed a spur from a deviated septum that was sticking into a swell bud in the side of the nose, and sent her to an ENT surgeon specifically with the request for him to take out that spur and correct that septum, and that solved the problem altogether. So you can see how complicated things can
Yeah.
be and how difficult it is to find,
Mm-hmm.
relief, but you,
Mm-hmm.
you can only find relief through the right diagnosis. That's always extremely important, that you get the right diagnosis and pursue the treatment accordingly. But it can be extremely difficult, especially because of the fact that it's really no man's land a little bit, you
Mm-hmm.
know?
And I think the early we get something diagnosed, the earlier the better. So
Oh,
that, yeah.
absolutely, because this
Mm-hmm.
this this lady was really at the end of her rope when I saw her. She was
Mm-hmm.
really, you know, pretty much done with life. She just couldn't
Mm.
handle it anymore. She wasn't able to work. She didn't want to have a
Right.
family. Her life was basically put on hold by all of this.
Right. And if I ask you in brief, then what will be the key steps in diagnosing face pain accurately?
Yes, so the three steps would really be one, to make sure that you don't have nerve damage in the face. And again, you
Mhm.
can do that by just simply examining yourself. If you have nerve pain in the face, um, you have either trigeminal neuralgia, or you have what is called painful trigeminal neuropathy. And one of the most common issues there is what we call ophthalmic zoster, which is shingles of the forehead.
Mhm.
So these are really the two nerve conditions with face pain, but both of them, fortunately, they're very painful conditions, both of them, but fortunately very rare. So if you don't have nerve damage to the face, if you have normally functioning trigeminal nerves and you feel that touch normally on both sides and in all three areas of the face, the forehead, the cheek, and the jaw. The question is the pain central in the face or peripherally in the face? Again, if it's central in the face, it's a no sinus condition. It's peripheral in the face, it's a jaw muscle condition, as I mentioned, temporal mandibular disorder or TMD. So
Mm.
that's kind of the most straightforward way I think I can present it to
Yeah.
you.
And once diagnosed, the next big step is the treatment.
Yes.
So, what can actually help? Like, what are the treatment options for the pain? What are the tests or the scans that can be done? And are medications always necessary?
Basically, only one test that should be done, and only when you have pain located centrally in the face, that is in all likelihood due to a no sinus condition, and that's a CT scan
Mhm.
of the sinuses.
Mhm.
That is really very insightful. A test to have done under those circumstances, but it's very important that people not only look at the sinuses, it's a sinus CT scan, so that's where people tend to look at. But it's very important that people also look at the nose, because that's generally where the problem resides when it comes to face pain.
Mhm.
So that's really the only test. More testing is really not necessary than that. And in terms of the treatment, it really depends on what the cause is. If you have that central face pain on both sides, the underlying cause is chronic allergic inflammation of the lining of the nose and sinuses, and you would treat that with an anti-allergy nasal spray. That could be an antihistamine nasal spray like azolastine, a mast cell stabilizing nasal spray such as cromolyn, or a corticosteroid nasal spray. Many of them are available also over the counter. If it's one-sided face pain centrally in the face, it is due to a piece of bone that comes off a deviated septum that sticks in a swell body in the side of the nose, and that needs a very minor surgical procedure that really any ENT surgeon should be able to do. If the pain is more in the jaws, related to temporal mandibular disorder, appliance therapy is really the standard. But also adding to that, injections with botulinum toxin can be very, very
Mhm.
helpful. If the pain is nerve pain, it depends whether you're dealing with what is called trigeminal neuralgia or painful trigeminal neuropathy, such as ophthalmic zoster, shingles of the forehead. Medications are used that fall into the category of anticonvulsants or anti-epilepsy medications, such as carbamazepine or carbazepine for trigeminal neuralgia, and gabapentin pregabalin for painful trigeminal neuropathy. I don't like those medications because they tend to have side effects, especially affect balance, and in an older individual, that certainly can be problematic because it leads to falls. So, for example, trigeminal neuralgia, I myself also like to treat with botulinum toxin. I use a very tiny needle and inject small amounts of the toxin into the affected skin, and if necessary, also the affected gum.
It might be very painful to have those needles in your face, right?
Not really, because I use very, very fine needles for
Okay.
that. Also, when I do the botulinum toxin injections in the jaw muscles,
Mm.
um, First of all, I take my time doing those injections, which is
Mhm.
very important. You don't want to rush through a procedure like this, but
Mhm.
also use very, very fine needles. And certainly when it comes to trigeminal neuralgia, I use very tiny quantities of the toxin. So it may be a little uncomfortable, but it's certainly not painful, and it shouldn't really be painful.
And like, are medications always necessary?
No, no. And also, if I use medications, for example, if you have chronic allergic rhinitis as the underlying condition of your central face pain, I myself like these medications in a nasal spray rather than that you have to take those medications by mouth,
Mhm.
because I think it's better to apply them there where the problem lies rather than taking them and basically getting them into your entire body where they don't need to be. And when you do take them by mouth and they get into your body as a whole, you tend to get side effects from those medications.
Right. And like physical therapy or the relaxation techniques or the lifestyle changes, they can help managing face pain.
Yes, so physical therapy, lifestyle changes, relaxation exercises can only help face pain that is located peripherally in the face and that is caused by temporomandibular disorder, because
Mhm.
that pain is from muscle tightness.
Mhm.
And for example, a very simple physical therapeutic approach is to get small heating pads. I like the microwavable heating pads and apply them once or twice daily. You need to apply them every day for about 15 to 20 minutes.
Mhm.
Maybe in the morning, apply them to the jaw muscles, and maybe in the evening again. And while you're doing that, you can do gentle stretching of those muscles. That's perfectly fine too. You definitely want to make sure you don't overstretch, because that will cause them to go even more into spasm. And also certainly relaxation exercises might be helpful to do, especially when you are a relatively anxious person, and that certainly would make that worse. Doing relaxation exercises is helpful, but for that to be helpful, you really need to do them on a daily basis, and maybe several times in a day.
Mhm.
And lifestyle changes, again, relating to temperamental disorder, or I think pretty much always, with that condition, have what we call bruxism, which is clenching and grinding of your teeth. That typically occurs at night and you're not aware of it. Maybe other people can hear that you're grinding, but you yourself wouldn't be aware of it. But when you happen to notice during the day, for example, you're sitting in your car, stressful, or at a stressful meeting, you're clenching your jaws. Become aware of that and then press the tongue against the roof of your mouth, and that will relax the jaw muscles and get you away from clenching your teeth.
And like many of our listeners, they are curious about the myths and the practical advice about the face pain. So, what is the most common myths you have heard so far?
Yeah, the most common myth with regard to face pain is that the face pain is due to trigeminal neuralgia.
Mhm.
That is a very severe form of face pain.
Mhm.
You get these jabbing, lightening pains in the face
Mhm.
due to nerve damage. Um, it is a rare condition, however. It affects mostly older individuals like myself, people in the 70s, 80s, or even older than that. It's overdiagnosed, and as a result of that, also overtreated. The reason it's overdiagnosed is because of the fact that that's pretty much the only face pain condition that physicians learn about in medical school.
Mhm.
And hence, when they see a patient present with face pain, that's what they will think about, regardless of what the face pain presentation is, because that's the only face pain condition they are aware of. The most common face pain condition, in fact, is temporomandibular disorder. That's not taught in medical schools at all, so physicians tend not to know anything about that. That is taught in dental schools, however, so dentists should be aware of it, but at the same time, dentists, they tend to focus on your teeth rather than on your jaws. When you're sitting in the chair, the first thing they'll ask you is to open your mouth. So that's where they go. And they're not necessarily focused on, a source of pain outside of the mouth in your jaw muscles. But it's really their territory. But again, as you can see from the educational perspective in medical and dental schools, face pain is something that is kind of left out there. And then if you're struggling with that yourself, I think the best way, I think to go about it two ways. One, you want to talk to your primary care physician as well as to your dentist. Talk to both these practitioners about your face pain and see what they have to say. Both may not have to say anything about it, but at least it's something to address with both practitioners. The other thing is to try to educate yourself to the best of your abilities, and not so much by searching the internet, because you get very fragmentary information there. It's difficult to piece it together unless you're a professional. I think when you're a professional, I think you can, because of your background, you can put it all together. But when you're not a professional in the field, there's no way you can put it together when you get those pieces of information from the internet. So, for example, look on Amazon and look for some books on face pain if that is the problem that you're struggling with. There are some books available. I would suggest, having seen those books and read them, make sure you read a number of different books, because the books tend to all address it from a limited perspective. So in order to get a good idea, you have to read a couple of those books and try to piece it all together. I myself have published a book early last year called Headaches: Why You Have Them, What You Can Do About Them. And although the title relates to headaches, the book certainly also contains information regarding face pain. And in fact, the last chapter, chapter 16, is entirely dedicated to face pain, and also kind of gives you an idea how to approach face pain, both diagnostically as well as therapeutically, how you can figure out what kind of face pain you have, what the origin of it is, and also what the various treatments are that are available for the different types of face pain. But so educate yourself, I think, is key. Don't just go to a zillion doctors or other kind of practitioners. Try to work with your primary care physician and your dentist, but educate yourself through books.
Yes, I think you are right, because a lot of misinformation is there on the internet, everywhere on the social media, and those information is not given by the professionals also. So they are doing more harm than good to the people who are already suffering from these problems. So,
Yeah, and it also tends to add to the confusion, because I think there's a lot of confusion. That's why I'm happy that we talk about the topic of face pain, because I think it's a very confusing issue, not just for patients who, not just for the people who suffer from it, but also for the healthcare practitioners who are trying to take care of those patients. They very often struggle along with their patients because of limited knowledge, and the fact that it covers both the dental and medical profession, and in medicine it covers neurology and ear, nose, and throat. So it's not really necessarily contained within one specialty or within one type of healthcare practitioners.
and like according to you, if someone is experiencing face pain and unexplained face pain, then he should go to the dentist as well as a physician right away.
Yeah, I would consult both the
Okay.
dentist and the primary care physician. You may be able to get somewhere there, but it's also very well possible you don't get anywhere. I wouldn't be surprised if you don't get anywhere, even though you consult those two. But I think that certainly would be where I would recommend patients to start. Sit down with the primary care physician and sit down with the dentist and talk about your problem and see what they have to say about that. But knowing both professional fields well, again, I wouldn't hesitate if you don't really get a satisfactory answer. So I do think it's very important that you educate yourself in addition to that.
Right. How can patients they can advocate for themselves if their pain is being dismissed?
Yes, so if you have pain, don't let yourself being dismissed. Continue to seek medical care, but try to do it in a systematic fashion. And again, the only way you can really do that is by educating yourself. You know, you kind of have to get some kind of a basis in terms of knowledge, if you want to know which direction you want to turn to. You don't just want to go and consult random people because you get so many different opinions and it becomes
Mm.
even more difficult to put it all together, and it
Right.
only adds to the confusion and
Mm.
I think as a result to the suffering. You know,
Mm.
the pain is already bad enough, but if you have to also deal with all these conflicting opinions that people may have. You know, you see 10 physicians, you get 10 different opinions. That's the
Right.
way.
Mm.
That's the way it is. And I don't even want to say unfortunately, that's the reality of it.
Mm.
And that's because, you know, medicine is as much an art as it is a science, and it also very much depends on the educational background that the particular physician or healthcare practitioner has. So face pain can be extremely difficult, suffering through it, but also trying to find the right care for
Mm.
yourself.
I think you have a very,
Absolutely.
yeah, I think you have a very valid point. Like if we are consulting 10 physician for a one problem, then everyone has different opinion, everyone has different way to diagnose and treat it, and it can be very confusing. And like we have to stick to one physician and we have to continue the diagnosing and treatment with that particular physician also. We have to trust him.
Yeah,
So,
I think so. That's also why it's important to work, I think, with the two healthcare practitioners that
mhm,
you tend to deal with, your
mhm,
primary care physician on the one hand and your dentist on the other hand, and try to work it out to
mhm,
the best of your abilities. But at the same time, I think having at least some knowledge yourself, I
mhm,
think,
is also
is
important. Yes.
extremely, yeah, would be extremely helpful.
Mhm.
And again, you know, in my book, I really try to lay it out
Mhm.
with regard to face pain, especially in chapter 16,
Mhm.
how you should be looking at a problem like that and how it can be approached both diagnostically and therapeutically.
Mhm.
I've tried to do that in relatively simple terms to help people kind of
Mhm.
move forward on that path.
That's really good. You have written a book now. People can get awareness, right? Education from that, and they can knowledge themselves about the problem.
Yeah, which I think is especially important in face pain because of the fact that, um, you know, it is a field that physicians and dentists have very limited knowledge
Mm.
about, and you may just fall between the cracks here.
All right. And are there any lifestyle changes or habits that can reduce facial pain episodes?
Um, in terms of lifestyle changes, I think really only related to the temporomandibular disorder.
Mhm.
Um, as I mentioned, that tends to be associated with clenching and grinding, and that's certainly something to pay attention to and get treatment for with appliance therapy, with botulinum toxin treatment of the jaw muscles. I really like the combination of the two. I think appliance treatment is really the foundation, but I think having botulinum toxin injections in the masseter muscle in addition to that tends to be very helpful. And yeah, I think that's really it with regard to lifestyle changes. There's, I think, less you can do with those things when it comes to face pain than, for example, when it comes to headaches. In that sense, headache and face pain are different conditions, and they certainly also have different approaches to them. Face pain is really more cause driven in terms of the diagnosis and treatment. And as a result of that, it tends also to be a lot more straightforward and effective. So, you know, if you have face pain, you should definitely, you know, look for the right diagnosis and treatment.
Thank you so much, Dr. Spierings, for coming again and sharing your expertise on face pain. I think this was an eye-opening discussion and like something often that is misunderstood by the viewers and the patients, but it is very important to address. Uh,
Absolutely, I fully
yeah.
agree with you.
Yeah, and for our listeners, if you want to learn more about Dr. Spierings, you can check out his book. I will give all the links in the description. And for me, please like, share, and subscribe to this episode if you found anything helpful. Thank you so much. And we
Thank you
will,
very much.
yes, thank you so much for tuning in, and we will see you in the next episode. Thank you.